Hi guys, we will be starting the session in a minute, so ask everybody to join in. Okay guys, so we will be starting the session today. For those of you who didn't attend yesterday's lecture, I will advise you to listen to the YouTube video that's which link has already been shared on the group. Did you guys encounter any difficulty yesterday? Please let me know right now so that we can go through it again.
No, ma'am.
Okay, right. So Judith is like a thumbs down, really.
Yeah,
Judith.
thumbs down onto no problem. We got it.
Oh, okay, okay, got it.
Mhm.
Okay, so we will be starting our session today. I will be sharing my screen. Wait a second. Okay. I still hate it. I lost my stylus a long time ago, and now I have to do it on my phone, which I totally hate. Let me start the note again. All right, okay. So we will be starting with the trials. Why isn't the pen working? Let me see. What damn. Okay, so we will be starting with our trials. What do you know about trials?
Like they're done to test like
Maybe
a drug
Randomized
or
control
efficacy of the
trials.
drug.
How many trials are there?
four.
Or
Four. Very good. Four. One, two, three, four. What do we see in the first trial?
We check for safety of the drug.
Okay.
We are talking
What?
about, ma'am, the clinical trials.
Yeah.
So, ma'am, there are basically four trials, and the first one is that the zero category is basically the laboratory study in which they are basically studying about the medication, its potential effects, or anything. Then, when they
Mhm.
move toward the first stage of the trial, so basically they are looking at a group of healthy volunteers on which they are testing their drug. And when they
Mhm.
move to the second clinical trial stage, so basically they are looking at a small group of unhealthy individuals who have the disease, and they are
Mhm.
checking the efficacy of drug in them. And then in the third stage of the trial, they are looking at a large number of unhealthy volunteers who have the disease, and they test the effect of the drug on them. And the fourth trial is basically once the drug has been out in the market and some
Mhm.
kind of any adverse effect or dosage related issues are encountered. So basically, they are now experimenting on that. So that would be the fourth stage of clinical trial.
Exactly. Very good. So first, in the first, so usually they do not ask about, phase zero, but there's also this phase zero, which is, the initial pharmacokinetic and pharmacodynamics. We test the drugs, pharmacokinetics and pharmacodynamics in the phase zero. But on USMLE step one, they don't want you to know, phase zero. They would want to know that the first phase is associated with pharmacodynamics and pharmacokinetics. All right. They do not test you this in terms of phase zero. I know in first aid it's written that phase zero, you see pharmacodynamics and kinetics, but on USMLE step one and UR, it's usually right in the phase one clinical trial. Okay. So click phase one for pharmacodynamics and pharmacokinetics of a particular drug. All right. Then we have phase two. The first question we ask in phase two is, does it work? All right. Does it work or not? And how will we see if it works or not?
by
Come
giving
on.
it to the diseased individual, the one who have
Exactly. How many people? To a small number of
small
people.
number of people.
Very good. Okay. So to a small number of people, we will give the drug to see if it works or not. This is phase two clinical trial. Okay. So phase one, we see the pharmacodynamics and the pharmacokinetics. Phase two, we see that, does it work or not? And we give it to a small number of people. Phase three. What do you mean by phase three?
Now there is a
There
large group of
you
diseased
want to
Exactly. Now you give to a large group of people, okay? So in phase one, you check the pharmacodynamics and pharmacokinetics. So you see, is it safe? All right. So you ask the question, is it safe? Phase two, does it work? And phase three, what are you asking? Is
To
there
improve care. Yeah.
any improvement? Very good. All right. So that's what you see, any improvement. Okay. What do you see in phase four? So phase four, usually after phase three clinical trials, the drug is, put up in the market. All right. Phase four clinical trials are usually monitoring the long-term effect of a particular drug. All right. Like any adverse effects. All right. If there are any adverse effects related to the drug, which can be only found out if you put a patient on the drug for a period of time, for an extended period of time. For example, you are giving paracetamol to your patients, okay, and now you need to monitor if the patient is having retinopathy over the course of 2 years. So that will be a phase four clinical trial, okay, because after it has been put into the market, then we are monitoring any sort of adverse effects in a particular drug. That is phase four clinical trial, okay. After it gets FDA approved, then we put it into phase four. Okay. Is it clear? Which we also call it as a post-marketing surveillance of the patients. Okay. So now we are repeating again. What is the phase one?
how is the drug safe?
Exactly.
Pharmacokinetic.
Is the drug safe?
Pharmacokinetic and
Very
pharmacokinetic.
good. Does
Yeah.
it, second, you ask, does it work? And you give it to
Does
a
it
small
work?
number of people, right? In
Mm.
three, you see, you give it to the large group of people and you see that, okay, it's working, but is it causing any improvement? All right.
Yes.
And for fourth, you just see the at long-term adverse effects. Okay. Then we are going to do preventions. How many types of preventions are there? Does anybody know? Primordial prevention,
four
primary, secondary,
and tertiary.
tertiary. Very good. So usually they won't ask you primordial. Okay. They will only ask you three: primary, secondary, tertiary. Now, what do you mean by primary prevention? What is primary prevention?
Without symptoms or risk factors included. Like um
We are avoiding
like
risk
vaccination.
factors. Risk factors
Hmm.
are avoided.
Primary prevents. Okay. So what is any sort of primary prevention?
Screening tests.
Mm.
Vaccination.
No.
Vaccination.
Screening is secondary.
Vaccination.
It's like excluding the
Vaccination.
number of people with
Mm.
like who are above 40 or sedentary lifestyle to have a good walk or have a good diet so they do not encounter hypertension. So it's
Or
that
yeah,
kind of.
like smoking cessation or exercise to prevent the
Exactly.
disease from
So
occurring.
any like dietary modifications or any sort of like exercise or any sort of things that you're doing to prevent you from developing that particular disease. For example, if you're having if the patient is at risk of developing cardiovascular disease, so you tell the patient to do dietary modifications, to cut on cholesterol, to have a good lifestyle, and then do exercise daily. All of that is just primary prevention, because we are stopping the patient from developing the disease. So that is why primary is known as prevent. Okay. Another example they ask you in USMLE step 1 is of vaccination. These are very high yield. Okay. They will most likely ask you primary prevention in terms of vaccination. Okay. So primary prevents, most likely it's any sort of vaccination. All right. What do you mean by secondary?
Okay, that's
That's
the
that's
screening. And
yes,
this is
that's
yeah.
screening with a group in those that are in risk factors or some that have at risk of
Yeah,
it.
We are avoiding complications.
No,
exactly.
that's too sharp.
No, it's basically
So
It's like
screening.
secondary
Screening.
So secondary screens, primary prevents, PP secondary screens. All right. Any sort of screening test will be a secondary prevention, like colonoscopies. We are catching the disease earlier, like pap smear, okay, like a mammogram, like a DEXA scan. All right. They all are screening test. Okay. So that is why secondary prevention comprises of screening, any sort of screening test that is catching the disease earlier, like colonoscopies, pap smear, mammogram, DEXA. They're all types of secondary prevention. Okay. Then what do you see? What is tertiary medication? Tertiary prevention.
Preventing
So we treat
it has happened, but in this case, you're trying
it.
to prevent the consequences or complications.
Very good. So tertiary treats. All right. So tertiary treats any sort of medication. For example, you can, for example, we're giving the medication for stroke so that the stroke doesn't develop. This is a type of tertiary medication where we are already giving the patient some sort of intervention so that long-term disease cannot happen. Okay. So tertiary treats any medication that you will give to the patient is tertiary. Okay. Secondary screens, any sort of screening test, colonoscopy, pap smear, mammogram, DEXA, their secondary prevention. Any sort of primary is preventing any sort of vaccination, diet modification, exercise. That's an example of primary prevention. Okay. Is it clear, guys?
Yes.
Okay,
Yes.
now we move on to the second thing, likelihood ratio. I think I did not tell it yesterday. So there are two types of likelihood ratio, positive and negative. Does anybody know the formula of positive likelihood ratio?
Sensitivity divided by 1 minus specificity.
Very good. What does sensitivity tell us? True positive? Does sensitivity tell us true positive or not?
Uh, yes,
Yes.
it's
Yeah.
true positive. Rule out the disease.
Very good. So it usually gives us a measure of how many true positives are there, right? 1 minus specificity, what does it tell us?
false.
False positive. All right. Usually in terms of specificity, that's false positive, and sensitivity tells us a true positive. So positive likelihood ratio is sensitivity over 1 minus specificity. If they ask you negative, then you just reverse it. 1 comes up, so it becomes 1 minus sensitivity, and down comes specificity. All right. So this is the negative likelihood ratio. In terms of exam, they will give you a question, and in the end, they will give you a line. What is the positive likelihood ratio of this? Or what is the negative likelihood ratio? Then you have to apply this formula onto that question so as to you can solve it. All right. Again, very easy type of questions would be asked. Do not panic. If you know that this is the formula, then you can take out sensitivity and specificity from the 4 by 4 chart, what we discussed earlier. All right, you can put in the values over here, and then you can do the solve it, and then you can get a positive likelihood or a negative likelihood ratio. Don't worry, we will again solve questions, so you will have an idea of how to solve it. Okay. Then I think I did not tell you standard deviation yesterday. Again, standard deviation is very, very important. Okay, what do you mean by, okay, what is generally standard deviation? What do you mean by standard deviation? Can anybody
It
tell us?
basically means that how much of a population is deviating in a, for example, if a normal bell Gaussian shaped curve is made, so how much of the population is coming, if it is in the first deviation, standard deviation, so 65% of population will be in that. And if it is two standard deviation from that, so it will cover the 95% of population. And if it is three standard deviations, so it will cover the 99.7% of population in that, on both sides of the mean, right and left.
Very good. So for normal distribution, it will be a bell-shaped curve, like you were seeing this. This is known as a bell shape. You can see that, this is a bell, right? But this won't be drawn over there. So, but it's like a bell-shaped curve, okay? And in this, mean will always be equal to median, and that will be equal to mode, all right? So normal distribution, you will see that they like all are equal, but usually mean is the best, to get out the central tendency, the central point. You take the mean of it. You do not take the median, you take the mean of it. All right. Again, now how the questions will come, I will tell you. All right. So they will say, for example, that you did a test and the cutoff value of that test is 210. That's the mean cutoff of that test. All right. And they will tell you that with a standard deviation of 15. All right. And they will then tell you that how many percent population will be in the standard deviation of 15. All right. So they can ask you that question, or they can ask you how many of the population is left. So in the population, or they can ask you the amount of people that are left. All right. So when they said that 210 is the mean, you put 210 over here. Then they said that 15 is the standard deviation. All right. That means 210 plus 15. What is that? It's 235. And then you go back and you see what is 210 minus 15? Anybody?
195.
Ma'am, 225.
2,
195.
1, it's 195. We're going back. All right, 195. All right. So this is one
The right
standard
side is
deviation.
225.
35, not
All right.
235.
So this is one standard deviation, and any population coming in this is covering 68% of the population. All right. So this was one standard deviation. Are you getting me? So if they give you a mean of 210, you put the mean of 210 over here. And after that, you see, and they give you that there's a standard deviation of 15. So this is 235, this is 195, and then you can solve the entire chart like that, right? So if they keep on going that, okay, again, like 235 plus 15 is what? It will be, I think, 240, 250, right? 250. And then you can go back. What's minus that? It's, I think, 180, right? All right. Okay. Now, if you see this,
Sorry,
this is
I
two
couldn't
standard
get it.
deviation.
Dr. Maheen, can you go over standard deviation again, please?
Yeah. No, no, I will go it
Thank
again.
you.
Don't worry. Don't worry. All right. Okay. So what I meant is, wait, let me just erase all the data so that you guys can see it again. All right. So they will, what I want you to remember from over here, just for the sake of purposes, is just one thing right now, that this will be a curve, all right, in that one standard deviation is 68% of the population. That means that if they say that there is one standard deviation, then that will comprise of 68% of the total population. Okay. Two standard deviation is 95% of the total population, and three standard deviation is 99.7% of the total population. Now, they can give you a question and say that, okay, we did a blood test of cholesterol levels and we found out that the cutoff value of that cholesterol level is 210, that we will take as the mean. So when they said mean, I told you that in a bell curve, mean will always come at the center,
Center.
right? So it's a center, right? So 210 will come over here, right?
Yeah.
That's 210. Okay. Then they said standard deviation is 15. So then when we have that particular standard deviation, we have to add and minus from this mean. All right, all the
Yeah.
way throughout. Okay. So what you did, it was 210 plus 15, 235, 235 plus 15,
225, sorry.
It's
It's
225.
225. See, you guys are giving me wrong numbers. I told you I'm bad at maths. All right. So that's 225. And then you did plus 15 again, and that is 250. All right. Similarly, you will go, this is the negative chart. All right. And this is the positive. Okay. So 210 minus 15, 195, 195 minus 15, 180, and you will, the curve will go on and on and on. All right. So you don't have to worry about filling all the values. You only need three. Like I mentioned, they will only ask you three. 1, 2, and 3. That's it. So now we know that one standard deviation is 68%. So what is one standard deviation? Come on, guys. What is one
One
standard
standard
deviation?
deviation means the 68% population is covering in that area. That is the 100% minus 68 means 32% population is left behind.
Exactly. So now I will complete it for the purposes sake because I think nobody can understand this. So 195 to 225, that will be one standard deviation. Now you are like, oh, but this is 1 and this is 2. How come it's 1, right? So you have to see from the main line, right? Are you seeing this main line over here? All right. So this from 210 to 195, that is minus 1 standard deviation, and 210 to 225, that is plus 1 standard deviation. So collectively, it's a 1 standard deviation. Okay. Now this entire group from 195 to 225 will cover around 68% of the population. Is it okay until here?
Yes.
Yes.
Got it.
Okay, very good. So from 2 standard deviation, what will it cover now?
180 to 250.
180
Very
to
good.
240. 240, ma'am. Madam.
240, sorry.
It's 240. You guys again give me the wrong number.
Yes.
Okay, so it's from 180 till 240. All right, that's 2 standard deviation. 2 standard deviation will have how much of the population?
95%.
95%.
95%. All right.
95%.
And similarly for the 3 standard deviation, they won't ask you about the 3, but similarly, that's the same logic that's applying in 2 and 1. The third will also apply over there. All right. So now, if this 2 standard deviation has 95% of the population over here, all right, this is 95% of the population. Now, how much will be left behind? 5%, right?
5%.
Yes.
5%,
5%.
yeah.
So now what you have to do is you have to, because these are 2 points, 1 point and 2 points. So what will you do? You will divide this 5% into half. So this will be 2.5% and this will be 2.5%. All right. So whatever is left behind, you will divide it into half and you have to give this number. All right. You don't have to give this number. Do not make the mistake of giving this number. Okay, 95% is the people covering, and then you minus it and from 100, so you get 5%, or 5% is the population left behind. No, they're asking you in one particular place. Like, for example, they would either ask you from the positive side or the negative. Irrespective, the number will remain the same of positive and negative. All right. So what you have to do is you have to divide that whatever number you get into 2, because of course this is 1 and this is 2, right? There are 2 points. So you will divide the number equally into 2 halves and you will give this number as an answer. Okay. Is it clear, guys?
Yes.
Don't worry, again, we will solve this so you can get an idea, but just remember the basics of it right now. Okay. So like I mentioned in the above portion, that either they will ask you in or left. For example, if they asked you how many people are in the 2 standard deviation, you said, oh, 95%, right? 95% covering what range? 180 till 240. Okay. And if they ask you how many is left behind, then what do? 100 minus 95, that's 5%, and then 2.5 and 2.5. So 2.5% is left behind. Okay.
Yes.
Clear?
Okay. Yes.
All
Yes.
right. Very good, guys. Okay. Now we go on to the other thing. Let me see what I have to do. Okay. All right. Okay. Yeah. I talked about a little bit. No, I did not talk about the t-test and ANOVA. All right. What do you mean by a t-test? What's a t-test?
T-test compares the mean of two groups. Mean
Okay.
values of two groups will be t-test, and if you are going for more than two groups to just check for the mean values comparison, so that would be a ANOVA test.
Very good. So t-test is, whenever they give you two groups and they ask you the mean of that, all right? Like for example, they ask you for the difference between the means of two groups. So it is the difference of mean of the two groups, all right? So difference of mean of the two groups. If they ask you what type of test will that be, that's a t-test. If they ask you difference of the mean of more than two groups, then that will be an ANOVA, all right? So more than two groups, all right? If they ask you the difference of mean of two groups, then what test is that? T-test. If they ask you the difference of mean of more than two groups, then that will be ANOVA, okay? Is it
Yes.
clear? All right. Now, what do you mean by a chi-square test?
The chi-square test
You
is the
check the
normal.
difference between two or more percentage.
Hmm.
This is the normal contingency table that we form for calculating sensitivity, specificity, and all these things,
Hmm.
which has four values and two groups. So that is the normal chi-square test.
All right. Very good. Okay, let me just make it a little clear over here by this thing because it will be confusing to you guys. All right. Okay. So chi-square test does not involve any sort of number. All right. Remember that. In t-test and ANOVA, you will have number because mean is a number, right? So you will see numbers over there. But in this chi-square test, you will not have numbers. You will have variables. Okay. There is this thing we call as variables. Now, what do you mean by that? For example, anything aside of numbers. Okay, anything aside of numbers.
Like
Like if they mention it in words. For example, they say, "Oh, this is the height is compared to the weight," and they haven't mentioned the numerical value. Then that means they're referring to any categorical test. All right. Height, weight, all right. It can be, anything that's given to you in a descriptive manner and number is not given to you, then that will be a categorical variable. All right. Categorical variables are divided into two things. All right. Small sample size and large sample size. If you are doing a test of categorical variables with a small sample size, then that is called as a Fisher's test. And if you're doing it on a large sample size, then that's called as a chi-square test. Is it clear? Small fish because fishes are small. All right. Chi is large. All right. Again, you will see that in categorical variables, numerical values will not be there and they will give you descriptive manner of wordings like height, weight, pounds. All right. They can just give you anything like, I'm comparing the height of one group to the weight of the other group. Now, what is that sort of test? And if they say, oh, I have 100 people. Now, is 100 a big number or a small number?
a big number.
It's a big number, right? So then we will say it's
Yes,
a
so
chi-square test.
it's a chi test.
If they say, oh, we are just doing it for like three people, then it will be a Fisher's test.
A
All right.
Fisher test.
So this is very important. You just need to memorize the basics of it, and the rest of it is very easy. Okay. Sometimes people get really, really confused. All right. The other thing there is mentioned in first aid that is Pearson correlation coefficient. Okay. Has anybody read this in first aid?
Yes, that's mean the it is the basically the correlation between two variables. And when
Hmm.
what we see if the two variables are going in the same side, means if one is if we are increasing, we are adding one variable and the other is also getting increased, it means that is the positive correlation. And if we are adding one variable and the other is decreasing, it means the negative correlation.
Hmm.
And it is represented by a linear line, correlation line, on the graph.
Hmm.
Yes.
And strong,
Yeah.
So
basically,
it is the linear correlation between two variables. That's what it is. Correlation
Hmm.
between two variables.
Two variables,
Yeah.
yes. Mhm.
Again, you are right. Again, it is a linear correlation between two variables. Again, they will say R, they will mention the value of R. All right. Now, what do you mean by R? What is R? What is the value of R?
it would be
One.
like
It's a
now
positive
0 minus 1.
correlation.
One. Absolute value of R is 1.
Very good.
Positive,
So,
absolute, yeah,
so
positive.
again, the absolute value of R is 1. All right. Now, if you need to see a positive correlation or a negative correlation, in the positive correlation, the arrow will go like this. All right. And in the negative correlation, the arrow will go downwards. Now, what another thing I want you to remember over here is the dots. You see, I've made the dots over here. So if these dots are clumped together in the form of this arrow, right? In the form of this arrow, they're clumped together. Then that means it is a positive correlation. Similarly, if the dots are clumped together and they're coming down, then that means it's a minus correlation. What
Negative.
if these dots were very far away? What if they were like this? Then what?
No relationship. No correlationship then.
No
No
correlation.
correlation. Very good. So I want you to remember this. Pick the box in which all of the dots are clumped together in order to have a greater effect. Okay, so pick the box in which all of the dots are clumped together. They're very near to one another, and if they're all going up in the form of an arrow, then that means it's a positive, and if they're going down, then that means it's a negative. That's it. Aside of that, you don't have to remember anything. The more the dots are far away, then that means the relationship or the correlation is very weak. Okay,
Yeah.
is it clear, guys? That's it. You don't have to memorize anything else from this.
Yes,
Um,
yeah, but sometimes they will give you question where they'll put -2 plus
yeah, yeah. Oh,
0.8,
yeah.
and
Very
I
good.
get confused to
So
not.
what do you mean by -2? How do you know that it can be, -2? This is the minus thing. How do you know it can be -2? Where will the line of -2 will be? Over here or over here? At A or B?
It'll be farther away, like maybe negative correlation.
Meant
Yeah,
to
so
be
Be
this is a
B.
scattered.
negative correlation, right? So will you
Yes.
see the line over here at A or B?
A will be flatter.
Then it is negative correlation. Huh?
Very good. So
Be
it will
negative.
be flatter, all right? So this will be
Flat.
-2. So this, it honestly makes sense. Like the values will be given to you over here. It will be written over here. Don't worry, they won't give you an empty box. But then again, it just makes sense because if this is 1, right? Or just let's just take a positive example, right? If this is 1, wait, yeah. So if this is 1, right? If this is +1, then where would you see +2?
Above it.
Above it. Very good. So this will be +2, this will be +3, right? For negative, it will be the opposite. Okay. So that is why they can give you +2, +3, -2, -3, but again, you have to identify the dots. For example, if I draw a box over here, all right, and if I draw this line, wait, what type of correlation is this?
No correlation.
No.
No correlation, weak.
They're far
Weak.
from each other.
Weak positive
It is
correlation.
weak
Weak.
positive correlation.
Very good. Weak positive correlation. Okay. Now, if you just kind of see where are the dots more clumped together, they are kind of clumped together over here. More they are clumped together over here. Again, it's not
Strong.
it's not +1. Why isn't it +1? Because +1 will be here. It will start from this bottom and then it will go up. So if it is not +1, it wasn't this +1, then it's above that, so it will be a +2, right? Again, most of the times these are not considered good correlation. It should always be absolute +1. Okay, so they can give you +2 in this sense. Okay, but they won't give you it as a separate question. Similarly, for -1, let me just see. All right, so for -1, what if they give you like this? Then what is this?
That's a weak
One
negative
of
correlation.
negative.
Weak
Negative
negative.
correlation.
Weak negative.
Negative correlation.
Negative correlation. Again, you will see that if the line is drawing from over here. If it is drawing from over here, then this is -1. And if it is not drawing from over here and more of the dots are clumped together over this side, then the line will be drawing over here. What will be the value over here? Minus what?
More negative,
Minus
Minus
more
one.
negative.
-2.
-0.4. -0.2.
right? So it can be -2, it can be -3, right? So you see, so +1, it will go above the curve, and minus will go below the arrow.
Below.
Okay. So they will give you -2 in this sense. Again, -2 correlation will be a bad correlation. You don't want this. You want 1. Okay, so just remember that. And that is why I said, just remember that the more the dots are clumped together, that's a good thing. That's a good sign. We want the dots to stick around together. We don't want them far away, because the farther they're away, then that means that either there is weak correlation or there is no correlation. Okay.
Dr. Mahi, in the way you just drew this, can you draw one with no correlation? Let's see how spaced out the dots could be.
Yeah, sure.
Thank you so much.
Let me. Now, what's this?
This is no correlation.
This is no correlation. See, no correlation, because not even 3 to 4 dots are together to form a line, right? But if I would have given it like this, like, then what? Then it
Strong
becomes
Negative.
Negative
Negative.
correlation.
Negative
negative,
correlation.
right?
Mm-hmm.
So you have to draw a line onto that, right? Again, this is no correlation, this is no correlation, this is a negative correlation. Okay, so this I want you to remember. Is that okay? Everybody clear?
Yeah.
Yes, thank
Yes.
you so much.
All
Dr.
right.
Maheen,
Yeah.
sorry,
Yeah.
but can you explain it again?
Yeah, sure. Okay. So for correlation, I want you to remember that more the dots are clumped together, the more it's a good sign. All right. For example, I will draw it over here. That this is the box, all right, this is the correlation box, this is our value. Again, if you have this line, which means the arrow is going upwards, and that means it's a positive correlation. If the arrow is going like this, then it means it's a negative correlation. All right, now they won't give you arrows, but aside of the arrows they will give you a dot, right? There will be dots, and they will kind of like form an arrow. All right, so this will be a positive correlation. And if all the dots are like going down and they are all clumped together, then that means it's a positive correlation. Another thing, you want the value of any sort of either positive or negative correlation to be 1. All right, it can be +1 or it can be -1. So how do you know if it's +1 or -1? You have to check it from the corner of the box. That if the arrow is starting from the corner of the box to the up or the down, then that means it's either +1 or -1. If all the dots are not connected from the bottom of the square, and they are, for like further very far away, then that either means if there's no correlation, or it can be a correlation, but in terms of if it's positive, then, and if it's this is +1, and if all the dots are clumping over here, then it can be +2, right? If all the dots are here, it can be +3, right? Similarly, for negative, if this is -1, if all the dots are clumped over here, it can be -2. If all the dots are here, then it can be -3. So for plus, the arrow, you have to see upwards. If all the dots are connected over there, then the value increases +2, +3. But again, we don't want these values because these are bad values. We only want +1, right? Similarly, for the negative aspect. So in general, we only have to memorize that those correlations are good in which all of the dots are clumped together and they are giving us a value of 1. How will we know the value of 1? That if those dots are originating from the corner of the box. Is it clear?
Yes.
Okay, okay, okay.
Or, okay. Now, what do you mean by confidence interval? What's confidence interval?
How significant like something is.
So should it contain 0 or not?
If it's 0, it's not significant.
0.
Very good. Okay. So confidence interval, for confidence interval, I want you to remember that that confidence interval is significant in which it does not have the value of 0. For example, if I give you a value of 1.5 to 2.5, and if I give you a value of Let's just say 0.5 to 1, and I give you a value of -3 to 2. Which of them is not significant? A, B, or C?
B
B.
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 as
B.
well as C.
B.
No, you
C.
guys are. This is -3, guys. This is -3
Okay.
till.
Okay.
First,
That's
uh,
both B and
C.
C.
Then it would be
Uh,
C.
C.
C. C minus.
If C is -3, that's C then.
Yeah. So this is minus. Wait, let me just erase this. So what is the
only
value?
first value is significant. 1.5 to 2.5.
Why not 0.5 to 1? It does not have 0. So the only value over here that is not significant is -3 to 2. Why? Because -3, -2, -1, 0, then
Yeah.
1, and then 2, right? So this will be not significant. Why? Because it has to pass through 0 to get to 2, right?
Correct.
This has already passed from 0, 0.5. 0.1 can be significant, right? But 0 can be never significant. Okay, so this is significant. This is also significant. This can never be significant. Another example. All right, A, B, C. All right, so you have a value of 2.523. All right, you have a value from -2 till 4, and you have a value of 0.01 till 2. What is not significant?
B negative.
B.
A. C.
B.
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 Yeah.
B.
B only. B.
B
B.
All
only.
right.
B is
So
not.
any value that is crossing the 0 will never be significant. Okay. So this confidence interval is not significant. This can be significant. This can be significant. The second thing after a confidence interval you see is the p value. All right. So this, for example, for C, the p value is 0.0 wait 5. All right. And for this, the p value is 2. And for this, the p value is, let me just erase it, is 0.04. Then what confidence interval is significant? A or C?
C.
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 0.04. Yeah.
C.
All right. So what will you see in order to check for the statistically significant things? First, confidence interval. All right. The second thing you will check for the p value. The p value should always be less than 0.05, and confidence interval no 0. It should not have any 0. So if you check confidence interval and it does not have any 0, then you're like, okay, we can consider this. It can be right. Then you check for the p value. If it is significant, then that means that the confidence interval was significant. If the p value is not significant, then that means the confidence interval was not significant. Okay.
So a
Another thing,
p value less than 0.05 means not significant.
it means significant.
Okay, thank you.
All right. Okay. Another thing, the graph can also be presented of confidence interval in this manner. Wait, let me just see. All right. Yeah. So this can be a line. This is A, this is B, this is C. Which confidence interval is significant?
A and B because it's
C
on positive
and B.
side.
Yeah. Not
A.
crossing the midline. Anything
B.
not crossing the.
A.
B
C.
significant.
C.
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 A.
C.
Okay, it's not crossing the midline. C.
Not crossing. Yeah.
A and B both are correct.
See, so again, any confidence interval that is crossing the middle line, then of course it will have 0 value. Okay. So that will mean that it is not significant. So any value should not overlap each other. Okay. Again, another example of this can be given in this manner. So, for example, confidence interval, there are for A, there are two values, and for B, there are two values. Okay, it can be from 1 till 3, and it can be from 0.09 till 3. All right, the other value is from 2 to 4, and it can be 5 to 6. Which is clinically significant? A or B?
A. A.
A.
B.
B.
Huh?
B.
A.
B.
B because the
B,
not
because there's
crossing
no minus.
zero,
Very
not zero.
B. B.
B.
B is a positive. There's no minus.
It's positive, yeah. There's no negative value.
no, no. Which is negative? Nothing is negative over here.
Means
If you
significant
say
will
-1,
No, it's not -1.
oh,
But
okay.
there's
Okay,
no
little,
there's
because
minus. So it's
it's
B.
below. It's below. So,
If both are positive, the big number is the significant.
What did
yeah.
I tell you above? That the number should not overlap.
Lap.
What is
Yes.
it doing? Will it overlap 1?
Yes.
Yes, A
Yes.
is not
in A
significant,
there
B
is
is
no
significant. Yes,
there
yes.
is no
So
overlapping.
not
So B
significant. Any number that is overlapping. So the reason that I made you understand this first, because I told you it should not overlap. Any number should not overlap one other value of confidence interval, because if it does, then it becomes not significant. Over here it will overlap, right? So this is 1 2 3 and this is 0.09, and after that 1 will come, and that will cause an both will have 1, and that will become not significant because then it will overlap a single number. In this there is no overlapping of number, so this will be clinically significant.
Okay.
Okay,
Mm-hmm.
so two things about confidence interval: it should not overlap and it should not be 0.
Mhm.
Okay, understood?
Yeah.
Or okay, does anybody have any questions until now? No, no questions. Okay, then we are going to start with the errors. So there are type 1 error and type 2 error. What do you mean by this? What is this? Can anybody tell me?
type 1 error means the researchers saying there is association, but in reality there is no associations.
Hmm.
It's false
Yes.
Type
positive.
Mm-hmm.
is
They're false
false,
positive.
false.
False positive.
Hmm. Okay.
Type 2 error is false negative.
And in type 2, the researchers say there is no association, but in reality there is association.
And
Type
null hypothesis is therefore rejected as false in type 1 error.
Hmm.
In
Very
type
good.
1, the hypothesis
Yeah.
is H0. H1.
Hmm. Yeah, you're right. Anybody else? Anybody else? Does anybody
It
else want
shows
to?
that there's an effect or a difference between the two variables.
Hmm. Yeah. Okay. So this is the chart that you need to memorize for your USMLEs. That this is the reality. This is H1, this is H0, or you can say positive or negative as well, right? This H0, there's again H0. Upper portion means that the study rejects H0, and the lower portion tells us that it does not reject H0. Okay, what does this mean, study rejects H0? What is the study rejecting?
The null hypothesis?
Yes.
Null hypothesis, yes.
The null hypothesis?
if there is type 1 error,
The set out hypothesis.
Null efficacy. No difference.
Very good. What do you mean by power? What is power?
Rejecting the null hypothesis
Power
when it
is
is
1
false.
minus beta. The top left corner is the 1 minus beta is the power.
Hmm.
Means the sample size. Like if they make a assumption at such a table, and even if they're not, so if they ask us that how we can increase the power of this test, so we would pick the 1 minus beta because that is the sample size. If that would increase, so the power would increase.
Hmm.
So if you increase the sample size, the power increase.
Yeah,
It's just if you
very good.
increase the sample size, the power will increase.
Hmm. Very good. What else? What else increases if you increase the power?
So basically, the true positives would increase the sample size, or I guess the true positives. So 1 minus beta.
Increase the sample size.
Very good. What else? Precision of measurement will increase.
Yes. The
Yes, because I
expected,
reduce error.
Effect size will
the expected
increase.
effect size will
The
increase. Yes.
precision will increase.
Yes. So what I want you to remember in the entire chart is that, it can be looking very tricky and, very confusing right now. What I want you to remember, two things that they ask you, and that is this power, 1 minus beta. All right, this power, 1 minus beta. I want you to remember this. I want you to remember that as the power increases, then, it what happens is that it decreases beta, right? Now, what is beta?
Type
Type
2
2
error.
error.
Is the
What does it
probability of
indicate?
making a type 2 error.
False
Probability.
negative. All right. So the more the power increases, the more the false negative decreases. Does that mean this? This is one of the top questions of USMLE step 1. All right. So this is beta. This is 1 minus beta power. This is alpha. I want you to memorize the chart. Do not dive into the concepts of it because it is very, very tricky for you to understand it. I just want you to remember for the purposes of USMLE step 1 that power is called 1 minus beta and the power increases so that the beta decreases. All right. What does beta justify? False negative. So if the power is increasing and the beta is decreasing, then that means false negative also decreases, right? Okay.
Yes.
Another
Yes.
thing I want you to know that if the power is increasing, then the sample size is increasing. Okay. That's one thing. Other thing is the effect size is increasing. Okay. What is
Mhm.
the third thing? Precision of measurement is also increasing. All right. There is one more thing. What else increases? Alpha level. Now, what is the alpha level? Can anybody tell me?
It is
Type 1 error.
Type 1 error, yeah.
What does the type 1 error indicate?
False positive.
false
False
positive.
positive. False
False.
positive error.
Very good. False positive. So if the alpha is increasing, then the false positive will increase.
Yes.
Yes.
What about the false negative? It will decrease. So if the power increases, false negative decreases because beta decreases and alpha increases, so the false positive will increase. Okay, these are two high yield questions of USMLE step 1. And that is why I'm repeating it again and again so it gets stick into your head. Even if you don't understand this dynamic, but I will tell you this dynamic tomorrow in the form of a question so that you can understand it better. But even if they ask you in terms of, like a question and you don't know what's happening, then you just see, oh, Dr. Maheen told us that power increases, so beta decreases. Beta is basically false negative, so false negative decreased. Okay.
Dr. Mahal,
Similarly, yeah,
so P equals 1 minus beta or P, what is that? P means,
P equals 1 minus beta. P is power.
okay, right. Thank you.
All right.
Then power.
And yeah,
Power is inversely proportional to beta.
You can also say that.
Yes.
Because if the power is increasing, beta is decreasing, so it's of course inversely proportional.
Yeah.
Yeah. You can also say that it's also directly proportional to alpha. All right.
Yes.
And false
Yes.
positive is increasing. Okay. Very good. Okay. What do you mean by statistical significance and clinical significance? Are these two the same thing?
No, they are not same.
No.
Why? Can anybody tell me?
I can try.
Statistically,
Yeah, go ahead.
like if it is something is statistically significant, so it's possible that if they are like, there was an example on UWorld that they were basically looking at a risk factor or exposure and the development of a disease. But in reality, there was no relation between those two, but the numbers were telling somehow another story. So that was statistically significant. But clinically significant is that though actually there was a relation between the factor and the disease, but the numbers were not telling the same.
Hmm.
Actually,
So that will clinically significant.
statistical significance means when a likelihood of a study results becomes significant, and the clinical significance is the treatment outcome significance, the clinical study.
Very good. So in statistical significance, I want you to know this, that it is defined by the likelihood of study results being due to chance. All right. So that word is very important, due to chance. All right. If there is a high statistical significance, that means that there is a low probability that the results are due to chance. And any other example I will give you, for example, they conducted an experiment, and throughout that experiment, they found out that, oh my God, the results were, so good, and the numbers are so good, like p value is less than 0.03. But in actual, when we applied the study to the patients, there wasn't any improvement in the condition of the patient. For example, we did a clinical trial of, let's just say, drug called aspirin. All right. We did clinical trial of a drug called aspirin, and we found out that, oh my God, the p value is less than 0.05. So it is significant, right? What type of significant it is? Statistically significant. But when
Yes.
we gave the patients, actually in a clinical setting, 2 to 3 patients, we gave aspirin, and we found out that there was no improvement. Then is this clinically significant?
It is
No.
clinically significant, but it is not
No. No, I'm
statistically
going to say
because the
no.
sample size was less.
It's not significant.
It's clinically significant, but it won't be statistically because we have the sample size is less, so our power is less. So if we were to increase our power or our sample size, so that would it will also become statistically significant.
Very good. So again, I said 2 to 3 because I wanted to check you guys. What if there was 2,000 and 3,000 people given and yet no improvement? Then what?
Then it's not basically,
Not
it's not significant.
significant.
Not significant,
Not
yeah.
significant.
Not significant. Okay. So I was checking you that because in upper portion I told you guys that power is directly related to the sample size. So if you want to increase the power, you need to increase the sample size of any sort of study. Over here, I gave aspirin to around 2 to 3 people. That was like very, very small sample size. So the power of the study was very less. And that is why this is power. I told you guys that P is power. So it was not statistically significant. Why? Because the power of the study was small. All right, 2 to 3 people. If I would have given it to 2,000 to 3,000 people, and then the p value would have been 0.03, then that means yes, it is statistically significant because a large sample size was involved. Yes, so the power is great, and the result is also less than 0.05. So yes, it is statistically significant. And if it also showed outcomes, that means that those 2,000 to 3,000 people got treated because of aspirin, then that was also clinically significant. But if those 2000 to 3000 people were not treated by aspirin, they did not develop any improvement, and that means that it was not clinically significant, because despite having a greater number of people, a larger sample size, we have done everything in our power to increase the power. And yet also it is still showing no improvement, and that means it was not clinically significant. Is it clear?
Can
So what
can
will
I
we
ask a
see?
question?
Power.
Yes.
Yeah.
From what number exactly will you consider a sample size like significant? Like, is it from 20 people, 100 people, like what?
Yeah, so you will
I think it's
be given a
300.
measurement in terms of population. Like, for example, they will give you a question, right, that the study was done around like 10,000 people and only two people showed improvement, right? Then 10,000 people is a big number, right? So that means the sample size is big, right? And only two people showed improvement, and that means it's not clinically significant, because we out of 10,000 people, only two people are showing improvement, and the study is not clinically significant because the sample size is large, right? But what if out of 10,000 people, around like 9,000 people showed improvement? Then that means the study was clinically significant because a lot of people showed improvement. Okay, so they will always give you a sample size in relation to the number of people who are actually showing improvement and not showing improvement. So you can get an idea from there. You do not necessarily have to think of a number. Of course, 50 to 100 is, I just gave you an example, but again, 50 is a very less number of a sample size. Usually, power or clinical trials are done in a varied number of people, right? Even in terms of meta-analysis, we check for the power of the study, and that is why when you read a meta-analysis, over there the power is mentioned at the top of the line. All right, because meta-analysis is the pooling of data of a larger number of studies. So you're pulling out a larger number of people. So it can never be 20, it can never be 30, it can never be 50. It's still small, right? It needs to be in like 100 plus, so that to be considered as a great number of sample size. Okay, is it clear?
Dr. Maheen, can you give an example for statistical significance?
I already gave you.
Because I didn't understand that part.
I already gave you. Yeah, so the statistically significant, like what are you asking in terms of what?
So the statistical significance means that you determine by the p-value, like if it's less than 0.05, that means it's statistically significant, right?
Very good.
Okay, right. Okay, I thought that I missed something. That's why I asked.
No, no, that's the case. But
Okay.
for that, you also need to check if the sample size is good or not.
Okay. Okay.
Okay. All right. So we are done with
So,
that. What?
so can we say basically, right? Basically, something is not really important unless it is clinically significant, right? It's not really
Yeah, yeah.
significant.
So it's not important. And if they're asking you in terms of clinical significance, then you're checking for the sample size and all. Otherwise, you really don't have to bother checking it.
Thank you.
Okay. All right. All right. Okay. So let me see what else is left. I think we are done with the most of it. What else is left? Let me see what else is left. Yeah, there were two types of study that I missed yesterday. One was the adoption study, and the other was ecological study. What do you mean by that?
The ecological study is for a big number of population, like between countries or like between areas or states of a country. Like a large populations is involved.
Yeah, very good. Large population. What about adoption?
Adoption, I'm not sure.
It's about the biological parents and the patient people who are got adopted, right? Study.
Yeah. Anybody else? So adoption, the name itself tells us adoption. All right. So it is basically comparing the behavior of children in biological children and in adoptive children. Right. That type of study is known as an adoption study. Okay. Is it clear?
Yes.
Everybody? And ecological studies, you are checking larger number of populations. All right, that's really important. I think most of it is done now. Guys, tell me what else am I missing so that I can go through it, because tomorrow we will be doing the questions.
Dr. Maheen, did you talk about meta-analysis?
Oh, no, I did not. What do you mean by meta-analysis? Yeah, what is meta-analysis?
Basically, we are reviewing 3 to 4 different kind of research or study about a certain disease or about a certain problem or an issue, and we do
Mm-hmm.
a comparative study. So that would be a meta-analysis.
Very good. Anybody else?
We pull the data from multiple previous studies and then we analyze it.
Yeah.
Analyze it using a software.
Yeah. So it is multiple studies, okay? When multiple studies are grouped together, it is known as a meta-analysis. Okay. Now it can be either a systematic review meta-analysis or it can be just a systematic review. Okay, so that the Dr. Manahil, if those of you who are attending the research workshops, she will tell you. But for meta-analysis, I want you to remember there are multiple studies that are combined together. Okay, it is the pooling of the data. So what you do is that you do a meta-analysis. Now, why are you doing meta-analysis in terms of USMLE? To increase the power. Because multiple studies will have multiple patients. And when multiple patients are there, then what will increase? Sample size.
Sample size.
And when the sample size will increase, the power will increase. Hence, we do meta. Clear?
Yes. Please, how do we interpret the forest plot?
For what?
Forest plot.
Forest plot.
Mm-hmm.
They don't ask you that on USMLE step 1.
Okay.
They will never ask you a forest plot. Even I don't know how to do it. So I'm not sure if they ask you on USMLE step 1. On step 3, they ask you forest plot. But I think it isn't mentioned
I
in
have
first year.
somebody that got the question, but I don't know
You
how
got the
she
question?
got it.
They will
Yeah,
never ask you in the
I
exam.
don't
Don't
know.
worry. They will.
But
you
they do
you
not
will
ask.
step on us.
Thank you.
Let me see. Oh, are you asking about pyramid? Are you asking about that? Are you asking about the
Yeah,
pyramid?
something like that. Yeah, something like that.
Yeah, the mortality, birth
Mm.
mortality and the
Yeah. What am I drawing?
uh,
Pyramid.
it's the
Of
pyramid and
No, it's
okay.
not this one that I'm
Demographic.
asking. Yeah.
the demographic pyramid. Okay, very good. So, this is the population pyramid. All right, and this is the age that's increasing. This came on my exam, so that is why I'm drawing it. So this is one pyramid. All right, another pyramid. I'm gonna draw that everything is the same. What does first pyramid signify and what does the second pyramid signify?
This one, the birth rate is increased and the mortality rate is also increased.
What about
And
the
the
second?
second one,
Yeah.
it's decreased, both birth and mortality rate.
Are decreased.
Decrease, yes. And the
Yeah.
population is stable, right? In this B?
Yeah.
Yeah.
Very good. And in this, the population is growing.
Growing, yeah.
Very good. So whenever you are seeing this type of pyramid, like in A, you are seeing that what is happening is that the population is growing. There are a large number of people that are getting added every year, and you will also see in this that the mortality rate is increasing, right? Why is the mortality rate increasing? Because the birth rate is increasing. More number of people are getting born, so that is why more number of people will die. This type of population pyramid is stable because see, every box is similar. So everything is stable in this over here. The birth rate is decreasing, the mortality is decreasing. Why? Because the birth rate is stable, so is the mortality. And that is why they're not making much of a difference. Okay. So, and that is why they're also decreasing. Again, what is the life expectancy in B? Is it short or long?
Long.
Long, very good, because it's stable, right? In
Yeah.
A, it will be
Short.
Short. Very good. So in A, it will be short. Why? Because the life expectancy is short, the birth rate is getting very high, mortality is also really high, the population is growing. In this B, the birth rate is decreasing, mortality is decreasing, life expectancy is long over here, and the population is stable. These are the four things I want you to remember regarding the population pyramid. Let me write it over here. Birth rate, all right, mortality, I want you to figure out from the graph. Life expectancy, I want you to figure out from the graph. And number fourth is population. That's it. These four things I want you to take out from the graph. All right. Okay. Another thing. Another I will draw. What if there is this? This is what?
You're declining.
Declining. What will happen to the birth rate?
Birth rate
It
will
will decrease. It will
reduce.
decrease.
Birth rate will decrease.
Yes.
It's a shrinking population.
Yes.
Population. What will happen to the mortality rate?
You'll decrease too.
It also decreasing.
Rate
Yeah.
decreased.
Decrease.
Yes.
Birth rate will be
But
decreased more.
More, yes.
Okay.
Mhm.
And the mortality rate will be decreasing, but birth rate will be more decreased. Okay.
Yes.
What will happen to the life expectancy is this? Is life expectancy?
Increase.
It will
Increase.
still be long. It will still be long.
increase long.
Long.
Very good.
Population.
What about population?
You're declining.
No, right?
Population
Because the mortality rate is low, reduced.
Their
more
population is reducing because
healthy.
it's going down, it's declining, is it not?
Growing.
Yes,
Growing.
because the mortality rate is low, reduced.
Slow.
No, the population rate will overall go down because the birth rate is decreasing. So over time, the
Decreasing. Yes. Population rate also
That's
goes.
that's what I'm saying. Is not-
See, birth rate is heavily decreased over here. So population over the time will go down. The population will decline,
Mhm.
right?
Mhm.
If the birth rate is heavily increasing over the time, then it automatically makes sense that the population number will increase because those children will grow up to become adults. So the population has increased, right? So it is the population depends upon the birth rate. If the birth rate is decreasing, then the population will decline. If the birth rate is increasing, like we saw in the first chart over here, then that means that the population is growing. If all of the boxes are same, then that means that the birth rate is declined, and so is the mortality because both of them are similar. So in overall perception, the population will remain stable because both of them are kind of equal, although they're down, but both of them are equal. Okay, so is it clear to everyone until here?
Dr. Maheen, so that means birth rate is directly proportional to the population growth. I mean, if the birth rate increase, the population growth increase.
I couldn't hear you. There's construction going on above my house and it's just dhar dhar dhar. So I cannot hear you. What else? What are you saying?
I'm asking if the birth rate increase, so so is it directly proportional to the population growth?
You can say that.
Okay, okay. Thank you.
That's another way of putting it. You can say that, but not necessarily they will ask you that, oh, is birth rate directly proportional to it? But
Yeah.
you can put it this way as well. All right. Okay. Now, two more things I would want you to know. What do you mean by mortality rate? What is mortality rate?
It's the number of deaths within a population over a certain period.
Very good. Again, number of deaths in general or due to any specific cause within a population over a defined period. All right. So, for example, if there are 80 people in a town of 10,000 and they die over 2 years, what will be the mortality rate?
Can you repeat? I can't hear.
Yes, okay. Could you come again? Sorry.
Okay, the question was that if there were 80 people who in a town of 10,000 people, all right, and they die over 2 years, then what will be the mortality rate? 80 people in a town of 10,000
It's
people over
low.
a period of 2 years.
Point zero eight.
0.008.
It's low.
Point
0.008. Yeah.
0.004
Eight.
annually or
0.08.
So what will you do? How will you calculate it?
We will divide 80
Maybe it's
over
per year.
10,000.
10,000, yeah.
No, but it will be actually no.
Divide by
It's actually for a 1 year, and you are asking
No,
for
I'm
2 years.
asking you about 1 year.
I think
You
just
So
divide
divide
into
by
two because it's
I'm
Yeah.
asking about 1 year. It's given 2 years.
yeah,
Yes,
so we need to
So if
divide
I
it by
divide it half, it will be
0.04.
0.
0.004. Okay. So that will be the answer of that. Again, if 80 people are in a town of 10,000 people and they like 80 people have died over amongst 10,000 people over a period of 2 years, what did you do? You divided deaths divided by per thousand people, and that is how you got to an answer of 8. And then you kind of, because I asked per year, so you divided that into half. That will be 0.04. Okay, is it clear, everybody?
Yes.
Yes.
Okay. What do you mean by attack rate? What's attack rate?
It's the proportion of exposed people who become ill.
Very good. Proportion of exposed people who become ill. Again, similarly, 80 people are in town and they are exposed and 60 people become ill. So 80 people are exposed and 60 of them become ill. What will be the attack rate?
60 over 80.
75.
3/4.
The people who become ill over the total population, so it'll be 50 over 80.
So
50 over 80.
the formula is people who became ill divided by total number of people
Total people
exposed. So
exposed.
how many people have become ill? 60, and total number of
60,
people exposed are
80. So it's
80,
60 over
0.75.
0.75.
0.75, yeah.
0.75. All right, that will be the
Mhm.
attack rate.
Yeah.
0.75 or 75%. And that is why it is a little important that you remember these formulas so that it becomes easy for you. Is it clear up to you up till here?
Yes.
Yeah. Okay. So I think that we are done. I think
Dr.
we covered
Maheen,
yeah.
that's another question that if state there's a graph called Kaplan-Meier curve. I don't
Yeah.
understand what is that, Doctor.
Kaplan-Meier curve. Let me see. Is it in the course today or not? Let me see. No, we have to do it tomorrow.
Okay.
All right. Okay. So Kaplan-Meier curve, we'll do tomorrow. Questions, we will do tomorrow. Two things we're going to tomorrow. First is the Kaplan curve that we are going to do tomorrow. The other thing is the questions. All right.
Okay.
Two things we are going to tomorrow. It will be a 2.5 hour long class, so please be prepared because tomorrow biostatistics will end. Right now, I'm going a few topics of ethics because I feel that that's important. So I want to go through that. All right, we still have 15 to 20 minutes.
So,
Yeah.
this is before we move forward, could I just ask, could you just reiterate what you said about the likelihood ratio one more time, please?
Likelihood ratio.
Mm-hmm.
Let me go up. Let me see the likelihood ratio. Okay. Let me see. Where did I mention it? Okay, large primary prevention we did. Yeah, this was a likelihood ratio. What did you not understand about this?
जी इसमें हमारे पे क्या हाल है फिर
So likelihood ratio is either positive or negative. This is the formula of it. Positive likelihood ratio is sensitivity over 1 minus specificity. Negative likelihood ratio is equals to 1 minus sensitivity over specificity. In the question, they will ask you what is the positive likelihood ratio or what is the negative likelihood ratio of a particular thing. You have to extract out sensitivity and specificity from the question, and then you can put it in the formula and get it. Okay.
Okay.
So sensitivity usually tells us the true positive, and specificity usually tells us the false positive rate. Okay, that was an information purpose question. Sorry, information purpose based thing. If you don't want to remember this, that's okay. I just want you to remember the formula of it. All right, is it clear?
Okay. Mm-hmm.
Okay. Now we are going to talk about a little bit of ethics principles because they're really important. What do you mean by autonomy? What's autonomy?
your rights over yourself, like self rights kind of thing, self-governing rights.
Yeah. Again, autonomy is every individual has autonomy. All right, every person has a certain obligation to respect patients as individuals, and you have to take informed consent from the patients. They're also liable to make their own informed decisions, so they have autonomy. All right, you cannot coerce them or you cannot force them into doing a certain thing because they are autonomous, they have their own independent will, and you cannot coerce them. Okay, so what do you mean by beneficence? What's beneficence?
Do no
Do
harm.
not
Always doing
harm.
good.
Do no harm kind of thing.
Do no harm.
Yeah,
Good.
so beneficence means
Happening.
do good.
Yeah.
All right,
Pushing
again,
patients'
yeah,
best interest. You
again,
had
you are doing good for the patient. Again, do know do again, that's the thing. If you're doing good for the patient, you're doing it for the benefit of the patient, hence the term beneficence. All right, again, you just do good for the patient. What do you mean by maleficence? What's maleficence? Non-maleficence.
Do no harm. Do no harm to the patient.
Give me an example of non-maleficence. For example, if a
The
patient comes to
decision.
you and he says, I want you to do me surgery so that you take out my appendix because I feel that my appendix can burst after 5 years. What type of thing will it be? Will it be beneficence or non-maleficence?
none.
Non-maleficence.
Non-malfeasance.
Non.
Non-maleficence, because again, you are not going to harm the patient because of their odd demands. Okay.
Yes.
For example, now if a patient comes to you and he suffered from a road traffic incident, he had pneumothorax, and you inserted okay, and you start sorry, just forget this example. For example, if a patient comes to you, he had a heart attack. Okay, and now you're giving CPR. You're giving CPR to resuscitate the patient, and meanwhile, by doing CPR, you broke two ribs of the patient. Will it be beneficence or non-maleficence?
It's a beneficence.
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 Because
Beneficence.
even though you broke two ribs of the patient, you still wanted the patient to benefit from the CPR,
Yeah.
right? And non-maleficence is you don't want to do any harm to the patient by usually they will give you a question in which the patient will come up with odd demands, or they will ask you to do odd procedures on them which are not necessary for them at a particular point in terms of medical point of view. So you refuse them out of non-maleficence. Okay. So these are the things that I wanted to tell you guys. Another thing is, okay, what do you mean by justice?
Equality. Fairness.
Fairness. Again, to treat every patient equally, irrespective of their gender, race, ethnicity. You have to treat every patient equally. Okay. Again, what do you mean by emancipation? What do you mean by emancipation?
When a child goes to the court or something to become an adult, like a minor, to have the rights over themselves or something like that.
Hmm.
When a minor, like someone less than like 18 years or something, goes to the court to be responsible for their own decision or something, to cut off like relations
There,
with the parents, parental consent kind of thing.
yeah.
Healthcare decisions on their own.
Yeah, decision-making capacity that they do on their own.
So, emancipation is a child who is legally under 18 and he goes to the court and he becomes emancipated, which means legally independent. In that case, you do not need the consent of your parents, of their parents, to make any decision regarding the child who is under 18. Okay? That is what emancipation means. Another thing I want you to remember that irrespective of the emancipation, even if a child is less than 18 years old, you cannot disclose certain things about a child without the consent of the child. Okay? And those are STI. What else?
Drug use.
Contraceptions.
Drug use. Like
Pregnancy.
substance,
Mm,
substance use.
mm.
Yeah. It can be abortion too.
Abortions. Yeah.
All right. It can be any drugs that you're using. Okay. What else?
STI?
Family planning, kind of.
Birth control.
Birth control. Yeah.
Yeah. Okay.
Contraceptive.
That's that. Contraception, OCPs, certain sort of traumas as well. Parental consent is not required. Okay. So these things you cannot tell the patient. You can patient's parents even if the child is under 18. Okay.
Dr.
You don't
Maheen,
have.
how about the mental health? Like if the patient has any mental health, is it
No,
no
no, you don't tell it without the consent of the child.
parent? Okay.
Sure.
Okay, even mental health comes in this, or depression. So you cannot tell it without the consent of the child. Again, another thing I want you to know about Jehovah's Witness. What do you mean by Jehovah's Witness?
These are
They are
Jewish
religious,
patients.
a branch of
They do not take
religion.
blood transfusions. These are Jewish patients who refuse blood transfusions.
Hmm. Okay, what if a family comes to you after a road traffic incident, and the every family member is wearing a Jehovah's Witness t-shirt, and it's not mentioned anywhere if they're Jehovah's Witness or not, and they're all unconscious. What do you do? Do you transfuse or you don't?
We
You
do transfuse.
You transfuse.
You transfuse
We transfuse because we have no direct.
because it's an emergency.
Yes, it's an emergency. Life is at stake.
Exactly. So that will be beneficence. Okay, that will be beneficence. You're doing it out of the
But
benefit
they're
of the
wearing
patient.
tag, showing that they are Jehovah Witness.
It does not really mean that if I'm wearing a shirt that says it's not offense, I'm just giving an instance. If I'm wearing a shirt that says I'm gay, that doesn't mean I'm gay. It's just a shirt.
Hmm.
The
Very
same
good.
way.
Dr. Maheen, if
It's
a
not
Jehovah's Witness child who's less than 18, I mean like 5 years old, and parents are there, but he has severe anemia and need of urgent blood transfusion. As a doctor, what do you do, Dr. Maheen?
You will transfuse. So
Okay.
I'm going to come to the point, but first try to remember this. If all of the parents or all of the family is, unconscious and they're only wearing a t-shirt that says Jehovah's Witness, you have no medical proof that, they did not consent for the blood transfusion, then you do it. You do the transfusion. Why? Because out of beneficence of the patient. All right. Now, if there is documented proof that they are Jehovah's Witness, then what do you do?
Then
You
for
don't.
under 18 we can give.
Can still
For
transfuse.
under 18 we can transfuse, but for above 18 we will not transfuse.
Very good. So child, you will transfuse, and adults, you
We will
won't.
not transfuse.
Okay? So childs are exempted from Jehovah's Witness. All right? Any patient who is 18 years old, who is, you know, who needs a life-threatening surgery, a life-threatening surgical operation to rescue that child's life, all right, you need that, or the patient can die of any severe bleeding, or the patient is at risk to die in any other condition, and they're less than 18, then you will do it irrespective of the patient's parents' wishes. Okay, you do not need parental consent for that. Okay, and even if the parent is like, okay, I'm going to take my child home, I don't want this surgery for my child, and you feel that no, the child can die if we take them out of the hospital, then you will still do the surgery of the child irrespective of the patient's wishes, because you feel that the child is going to die and the child's life is at risk. Okay.
Okay.
Yes.
So even then you
Yes.
do that. Okay. So, all right, let me see what else is left. And then we're going to wrap up the session. Okay, what do you mean by advanced directives? What's advanced directive?
That is a kind of a legal document in which a person has described that they are DNR or something like that, or they do not need a certain procedure. So that is a
Hmm.
kind of a legal document that is which we call advanced directive.
Hmm. Okay. So if a patient comes
The
to
legal
you,
document that is
Mhm.
written to give authority to some other person to act on your behalf.
Hmm.
That's like power of attorney, right?
Yeah.
Mhm. Okay, so if a patient comes to you and they are dying and they are DNR, but you want to insert the tube in the patient, can you intubate the patient if it's a
No.
DNR?
No.
You can intubate the patient because it was only a DNR. It
Yeah.
wasn't a DNI.
Not necessary.
Okay. So if the patient comes to you, it's a DNR, and you want to put the patient on ventilator, you can do that. You can intubate the patient because they only gave us an advance directive of DNR, not because of a DNI. All right. Similarly, vice versa, patient comes to you with a DNI. Can you do a resuscitation or not on that patient?
Yes.
Yes,
You
apparently.
you can because it wasn't a DNR. All right. What if it's both DNR and DNI? Then what will you do?
None.
Nothing.
Nothing.
You will not do anything. Okay. Again, another thing I want to mention that brain dead is the legal death in medicine. Okay. So if a patient has brain died, then you can pull the plug. You can take them off ventilator and you will not be held liable of the patient's death after that. Because brain death in medical terms means legal death. So you can remove the patient from the ventilator. But before removing the patient from the ventilator, you need to ask the patient's close family members' permission. Again, why are you doing it? Not because you are legally obliged to tell them, but because out of empathy. Okay, so this is a USMLE step one question. Most of the people pick, okay, no, now, no, we will go into the room and we will plug off the ventilator. Why are you doing it? At least inform the, the patient's family members. Oh, we are pulling off the plug. Do you want to say your final wishes? Why are you doing it? Because out of empathy. Legally,
Mm.
you're not connected to. Legally, you cannot tell. Even if you want to tell the parents, you can tell the parents or the family members. Legally, you're not obliged to take their permission to pull off the plug because it's a medical legal death. All right. But out of empathy, you need to go and ask them for their permission, tell them, and then pull the plug. Okay. That is always the right answer on USMLE. Okay. Other thing, if there were two family members and one of them said, okay, pull the plug, and other said, no, I don't want you to pull the plug, then what do you do?
You pull.
Don't
Basically,
remove the plug then.
There's.
basically,
I
we
thought
see.
there's a hierarchy to the like decision making. Like your spouse first, then children, then parents, something like that. So whichever one has the more authority or something, you take the decision of that person.
No, I'm asking in
We look
terms
for
of
the
legal.
legal representative.
No. Okay. So if you're having medical legal brain death, okay, and there are two people who, oh, sorry, there are two people you asked from the patient's family, and one of them has, said, okay, go ahead, pull the plug. One of them is saying, no, don't pull the plug. Then what you do is you go to the ethics board. All right, you go to the board, and that's usually the right answer on USMLE step one, two, or three. Then they want you to go to the ethics board. Again, you can legally pull the plug. Why are you doing it? So as to the one who did not give the permission take their concerns to the ethics board. Again, this is again a source of empathy that you're doing. Ethics board will of course approve you to pull the plug. So then you will go and then pull the plug. Is it clear now?
Yeah.
Yes.
First go to the ethics board if there is not both of the people are consenting. All right. Okay, that is, so we are done for today, guys. And there I think two to three other things related to ethics. I just told you the basics of it. Go through first aid. I think that you can, kind of go through it as well from first aid. But tomorrow we will be doing the Kaplan-Meier curve, and we will also be doing a number of questions. So it will be to a 2.5 hour class, very important class. I want you guys to be there. And yeah, do that for today. All
Thank
right.
you
Any
so much,
questions?
Dr. Maheen.
Thank you, Dr. Maheen.
Thank you, guys. Is there
Thank
a
you.
Thank you so much, Dr.
Thank
Maheen.
you.
You're
Thank you
welcome.
so much.
You're welcome. Is there a lecture today? I don't know if there is a lecture or not. Okay. What did they say in the group?
Nothing.
Nothing
Nothing. All
actually
right.
yet.
Okay. Ask about that in the group. And then I'll be seeing you guys tomorrow, same time. And inshallah, we'll cover both of the topics together, Kaplan mirror and questions that I will be sharing with you guys. And we will solve them together so that you can have a thorough understanding of biostatistics. Again, try to go through ethics from first aid. If there is anything that you guys feel that you don't understand, then come up to me and then, just write it down and we'll discuss it tomorrow. Otherwise, I really don't feel that I have to go through ethics because that's, I think, I think it's very easy to understand. So if go through that first, and if you feel that, you're getting stuck on one thing, then you can just bring it up to me and we can discuss together. All right? Yeah, I can explain the age pyramid tomorrow. But I think I did it today as well. But yeah, sure, I can do that tomorrow. Okay. All right, guys, I'll see you tomorrow. And yeah, you can leave the session.